When you hear the word stroke, what's the first thing that pops into your head? The brain, right? Of course. But what if I told you that for a huge number of patients, the real story, the root cause, actually starts somewhere else entirely? We're about to explore a really surprising connection between two of our most vital organs, a connection that can literally be a matter of life and death. Just let that sink in for a moment. It's a pretty startling idea, isn't it? The thought that a catastrophic event happening in your brain could actually be your heart's very first cry for help. And this isn't some hypothetical what if. For a lot of people, this is their reality. And here's the number that really puts it all into perspective: 30%. For nearly a third of all ischemic strokes, that's the kind caused by a blood clot, the problem doesn't start in the brain. It originates in the heart. That is a massive number of cases where, if you're only looking at the brain, you are missing the whole picture. Okay, so what's going on? What is it inside the heart that's causing all this chaos up in the brain? Well, it often boils down to two very specific conditions, and a lot of the time they're completely hidden. So let's break down exactly what they are. So on one side, you have atrial fibrillation, or AFib for short. Think of it as an electrical problem, a glitch in the heart's rhythm that's more common in older adults. And on the other side, you have something called a patent foramen ovale, or PFO. That's more of a plumbing problem, a tiny hole, and it can be a huge factor for younger stroke patients. Two totally different issues, but both can lead to the exact same devastating outcome. Let's look a little closer at AFib. Imagine your heart's rhythm goes haywire. It's just chaotic and irregular. This lets blood get a little lazy, kind of pooling in this tiny pocket of the heart. And you know what happens when blood just sits around? It clots. The real danger kicks in when one of those clots breaks free, hitches a ride through the bloodstream, and gets stuck in an artery leading to the brain. Now, the PFO, this is fascinating. It's basically a little leftover from when we were in the womb, a small hole that's supposed to slam shut after we're born. But in about a quarter of the entire population, it doesn't. And this creates a huge diagnostic challenge for doctors. Because a PFO is so common, they have to play detective and figure out, is this little hole just an innocent bystander, or is it the actual culprit behind the stroke? So you have this huge puzzle, right? Is it the heart? Is it something else? This exact problem is what led the Mayo Clinic to develop a really innovative new approach, one that's designed to get patients the right answer fast. And this quote just nails the whole philosophy. It's not just about having a neurologist and a cardiologist in the same hospital. It's about having them in the same room, at the same time, focused on the same patient. This just breaks down all the old barriers. It forces a neurologist who thinks brain first and a cardiologist who thinks heart first to combine their expertise into one single, unified diagnosis. And what's amazing is how this all leads to an incredibly efficient process for the patient. The experts do their homework on your case before you even walk in the door. Then you see both specialists in a single joint consultation. And the result? You walk out that very same day with a clear, unified plan. It completely eliminates weeks, maybe months of waiting and uncertainty. But okay, theory is one thing. What does this actually look like for a real person? Let's follow one patient's story, because it shows the profound impact this approach can have. I mean, this is a truly terrifying scenario. A 38-year-old woman, perfectly healthy one day, wakes up the next with the classic, devastating signs of a major stroke. Her entire life just changed in an instant. So doctors in the ER confirmed it was an ischemic stroke. They knew what happened, but they had no idea why. All the usual tests for common causes, artery disease, clotting disorders, everything came back negative. It was a complete mystery. This is what doctors call a cryptogenic stroke, which is really just a way of saying a stroke with an unknown cause. And this kind of puzzle is precisely what the Heart Brain Clinic was built to solve. And wouldn't you know it, they found the answer. A specialized scan revealed she had a PFO. So here's what happened. A small clot, probably from a leg vein, would normally get filtered out by the lungs. No big deal. But in her case, it took a detour. It passed through that little hole in her heart, a phenomenon called a paradoxical embolism, and went straight to her brain. The mystery was solved. So with a definitive diagnosis, the path forward was finally clear. She had a procedure to close the PFO, effectively shutting the door on that dangerous pathway and dramatically reducing her risk of this ever happening again. That right there is the power of getting the right diagnosis. But this isn't just about one patient's story, as powerful as it is. There's a growing, urgent need for this kind of specialized care all across the country. Now, here's a really alarming trend that's happening. We're getting a lot better at preventing strokes in older adults, which is fantastic news. But at the very same time, the rate is actually going up for younger people. This makes finding these hidden causes, like PFOs, more critical than ever. And the stakes here could not be higher. A stroke at a young age doesn't just impact a life, it can derail decades of it. The mortality risk for young stroke survivors is a staggering 5 times higher than their peers. That number alone just underscores the urgency of this work. Ultimately, this all comes back to the patient. In the confusing, terrifying aftermath of a stroke, probably the greatest gift you can give someone is clarity. And this model provides that. It replaces fear and uncertainty with a clear, confident plan for the future. And that leaves us with a final thought. This heart-brain connection is just one example. It really makes you wonder, what other medical mysteries are just waiting to be solved? Not by some new technology or a new drug, but by simply getting the right people in the same room at the same time to solve a problem together.